Good day, and welcome to this webinar, Prisons in Southeast Asia Neglected COVID-19 Hotspots. I'm Sunny Krishnan, Internews Regional Advisor, COVID-19 for Asia. Disproportionate number of COVID cases in prisons are part of the larger pattern of health disparity, lack of government transparency, and disregard of basic human rights. The pandemic has also exposed the impact of overcrowding and under-resourcing of prisons in Southeast Asia in the gravest of terms and through the loss of life. Prisoners with drug disorders are faced with grave challenges during the COVID-19 pandemic. The overcrowding and inadequate measures of personal hygiene expose these prisoners at a higher risk of infection than the general population. Sad to say, prisons are fast becoming the hotbeds for COVID transmission in this pandemic. Therefore, we must address prison overcrowding and promote the use of alternatives to imprisonment. Fortunately, today we have 4 prominent panelists in this webinar to talk about the dangers posed by COVID-19 to people detained and staff working in cramped, overcrowded conditions in prisons in Southeast Asia. Now, before we start, there are a few housekeeping rules. Mute your mic when the panelists are speaking. If you have any questions for the panelists, please post them in the chat function. Now, let me introduce our first panelist, Gloria Lai from the International Drug Policy Consortium, or IDPC. Gloria is the Asia Regional Director for IDPC and is based in Bangkok. I'll hand over the floor to Gloria. It's all yours, Gloria. Take it. Thank you.
Thank you, Sunny. Hello, everyone from Bangkok, from Thailand. I have a few slides. I think not all the speakers are gonna be sharing slides, but I'm hoping I'm going to be able to make this work easily. Okay, so I work for the International Drug Policy Consortium, as Sunny says, and obviously so we have a focus on drugs, specifically legal drugs, and laws and policies and the impacts of those laws and policies. So I'm going to speak just at a broader level around the relationship, the connection between drug laws and policies with incarceration in the context of COVID here in Southeast Asia. And I understand that our other panelists will speak in more detail on other aspects. And I think just to reflect on how the situation was before the pandemic, we were seeing global, increasing rates of incarceration around the world. And in terms of drugs, you see around 20% of people, almost 20% of people who are in prisons around the world are there for drugs. Around 4% of that overall population is there for drug use. That picture could be an underestimation because in a lot of times the way drug laws work, even if you're caught with possession of a certain quantity of drugs, even if they were intended for your own use, and not for sale, not for supply, because of the way drug laws work and sentencing under drug laws work, particularly in Southeast Asia, you're sentenced based on possession and quantity, and that if that exceeds a certain amount, it's almost automatically presumed to be for selling, and you'll be convicted and serving a term of imprisonment for selling, not consumption. If we look at, I think things to note in particular is that for women are more likely to be in prison for drugs than men. And the rate in which women are entering into prison is increasing at a faster rate than for men, particularly over the past 10 years. And in terms of women in prison for drugs, you see that in a very highlighted way, I guess, in Latin America, and in Southeast Asia in particular. I guess Thailand gives a very clear example where the overall population in prison in Thailand, around 70%, over 70% of people in prison in Thailand are held for drugs. For women is over 80%. In some prisons is over 90, pushing to 100% in Thailand. When COVID came, this was, I mean, I also didn't mention the extent to which prisons are overcrowded. Almost all prisons around the world are overcrowded to some extent. In Southeast Asia, the picture is quite alarming. When figures released last year show that in the Philippines, that they have the highest rates of overcrowding in the world. And over half of people held in prison in the Philippines are for drug offenses. And similar to Cambodia, where you have even higher proportions of people in prison for drugs, it's due to these large-scale anti-drug campaigns that were started as a political campaign by the government and administration since 2016, 2017 for Cambodia. And the fact that these prisons are so overcrowded, and we all know that to prevent COVID, you need social distancing, we're aware now even more, you need good ventilation, you need good standards of hygiene and sanitation, and prisons, especially overcrowded prisons, are just not able to provide that. We have people who are held in prisons who are they're already more likely to get tuberculosis, hepatitis B, perhaps HIV. They're already more vulnerable to these other conditions. So it's no different with COVID. And then it's even worse when you think of, if you already have HIV, if you're already living with TB as well, potentially hepatitis B as well, then you also have COVID. What are the likelihood of you being able to get good treatment it's low, because access to treatment, access to all these very basic kind of hygiene and healthcare is already restricted already. Last year, when there were some responses from governments to try to address the concerns of COVID spreading in prisons, but there were promises and not all of them were delivered in some countries around the world. And in Southeast Asia, in Indonesia in particular, in Myanmar, in Thailand, there were releases of, in Indonesia, over 20,000 people in prison. In Myanmar, it was a significant number as well. The problem is we don't have good data. We don't know exactly who were the people who were released, what were they convicted, charged with, to what extent were, how can we say how many people who were convicted of drug offenses were released? How many of them were people you could call vulnerable people? Were they people over 65? Did they already have some pre-existing medical condition? Why were they released? What grounds were they released? We don't really know, actually. The available data that we have is quite poor. In Thailand, and I think maybe I guess Pravit will probably speak more on this. We only heard a lot more about people getting COVID in prisons. It became covered more regularly by the news after there was a case of a high-profile person in prison being released and testing positive for COVID. After that, we now see regular news reports of the numbers of people in prison who have tested positive in Thailand. Don't seem to be seeing that regular information coming out of other countries in the region. These numbers are based from reports that we're able to see from the news online. We're not able to see recent data from Indonesia and Myanmar, where things are obviously in a higher state of concern. And if I jump now, just because I'm aware of the limited time that I have, I wanted to say the main thing around drugs is that prisons is not a given. It doesn't need to be an assumed outcome for people who engage in drug-related activities, in particular people who use drugs, people are held in possession for their own personal use. That the drug treaties actually promote or call for alternatives to conviction or punishment, and that there are ways, and that we need to have more dialogues around what those alternatives could be. I wanted to highlight the Bangkok rules, that in light of the fact that we have more women in prison, and more women in prison that this is a number that is going up at a faster rate, and that they're more likely to go into prison for drug offences. And we see this, I guess I have to say, Cambodia as well, not just Thailand. The need to be aware of the Bangkok rules, calling for the specific attention to the specific needs of women, particularly women with children, women who are pregnant, and for alternatives to incarceration to be sought for them. When we reflect back over the past 10 years in which since the Bangkok rules have been established, we haven't seen enough effort from governments to implement the Bangkok rules that leads to a reduction in the incarceration of women. Instead, we see continually significant increases in the numbers of women in prison, including in Indonesia, Philippines, and Malaysia. I'm just going to end there and allow more space for my co-panelists to comment before I comment further. Thank you, Sunny.
Thank you very much, Gloria. Yeah, perfect timing. We'll have the Q&A after all the speakers have spoken, and please drop in your questions in the chat box, yeah, and the panelists too can ask each other questions. Okay. Right now, we'll move on to our second panelist, Karen Peters from the UN Office for Drugs and Crime, DOC. And Karen is the regional drug and health program officer, and she's based in Bangkok, Thailand. UN DOC has been working a lot, behind the scenes with prison officials, trying to build up their capacity. And here in Cambodia too, where I'm based, they've also been involved in, handing out PPEs and protective gear, protective equipment to prison officials, and also to a certain degree help to distribute it to prisoners. And Karen will also talk about existing protocols with regard to the incarceration of prisoners, with an emphasis on Southeast Asia and what the UN body is working behind, how the UN body is working behind the scenes to advocate for prison reforms and to reduce overcrowding in jails and incarceration centers. And on to you, Karen. And thank you for joining us today.
Thank you so much, Sunny, and also greetings to the fellow panelists and to those listening. I'm not sure about my internet, but I hope it's going to stay with me through this short presentation. I'd like to thank Gloria for setting the scene. Usually, we provide this kind of sort of basic information around the situation of prison overcrowding and the drug policy, really the huge concerns that we have in our region. So Gloria has cut out a large part of what I wanted us all to understand from within Southeast Asia region. One of the main drivers for or feeders of the prison systems in our region is specifically, as Gloria mentioned, drug policy or drug issues. And she's already outlined that a lot of people are there for drug-related offenses, not particularly identifiable within the law as drug use, but also including possession and basic use of, or simple use of illicit substances. One of the main advocacy points that we as at UNODC and as the UN in general, we promote within the region is alternatives to incarceration, in particular for drug-related offenses, based on these definitions that Gloria have outlined, the problems related to this. We have in our region huge issues of prison overcrowding, the Philippines being the biggest concern within the region. but that doesn't exclude other countries, for example, Cambodia and Thailand, and of course, Myanmar. And so because of this, we needed to acknowledge and we needed to identify that addressing the issue of prison overcrowding within Southeast Asia really means addressing drug policy changes within Southeast Asia or within the countries in the region. In April of this year at the CCPCJ, the UN issued a common position on incarceration. This common position outlines basically all of what Gloria already mentioned, and I'm just going to highlight these key recommendations that came out of that common position of the UN. The first, of course, is related to the topic of this discussion, which is overcrowding and poor prison conditions. And the serious neglect of prison services causes prisons to be a weak link in the criminal justice system and a low priority in related reform efforts. The second issue or sort of observation was around prison management and the treatment of offenders that has an impact on the progress towards a variety of sustainable development goals. And we really see within the prison system or within the prison environment that a lack of adequate sort of human rights standards and health standards impacts directly the attainment of the sustainable development goals, particularly because people that are inside prison, the vast majority of them do eventually return to their communities at some stage. So prisons are meant to be temporary sort of transit spaces. They're not meant to be a final destination for many offenders. And this is exactly one of the reasons why the Sustainable Development Goals are a key sort of target that we should be looking for or looking toward when we're addressing prison issues. The third recommendation is around, given the closed nature of prisons and the inherent risk of abuse and violence in them, a twofold system of regular monitoring and inspections by the prison service on the one hand and by external independent bodies on the other hand is essential for preventing torture and the ill treatment of people inside those facilities. Many problems manifested in prison settings are the result of systemic deficiencies in criminal justice systems. Okay. I've mentioned already drug policies being sort of the area that needs to be addressed and for us to look at reforming and supporting the reform in that in order to ensure that there are alternatives to incarceration. And we'll talk a little bit about this in a minute. But besides drug policies themselves, as UNODC, the Office on Drugs and Crime, one of the main areas and one of the main bodies of our work is looking exactly at criminal justice reform and supporting the rule of law and supporting criminal justice systems. The second is around strategies to prevent and combat racism and racial discrimination inside criminal justice systems. And these should, of course, be in line with human rights law norms. The next point is specifically around COVID-19, and it looks at or it addresses the disproportionate impact that COVID-19 has had in prison settings. And has demonstrated what can happen when there is an already overburdened and ill-equipped prison system to confront this crisis. Not only for people that are incarcerated or people that have a sentence, but also for the people that live and work inside those places of detention. The post-COVID recovery will provide an important opportunity for criminal justice systems to address their chronic shortcomings. Okay. Again, our colleague from Thailand will probably touch a little bit more on that. But we saw that with this third wave of the pandemic we are currently experiencing, the prison systems within Thailand were really impacted quite heavily. This is a little bit different to what happened in the rest of the world, as you well know, because a lot of prisons were affected earlier on in the pandemic. But right now, this is already over 1 year into pandemic preparedness and response, and still the control of COVID-19 spread inside prisons is a major issue for Thai officials. In many cases, women offenders do not pose a serious risk to public safety. And Gloria has already mentioned that in her sort of intervention before. And that we need to really promote greater efforts to gender responsive alternatives. The UNODC and the Thailand Institute of Justice jointly released that guidelines on non-custodial measures for women in contact with the law. And this you can find online quite easily. And I think that's quite, it outlines very practical case studies also from our region on alternatives to incarceration or non-custodial measures. Although incarcerated prisoners remain a part of society, and I've mentioned that earlier in relation to the Sustainable Development Goals, the one thing that we don't really speak about a lot is that public opinion actually has a major influence on how policymakers respond to crime. While the public demand for harsher penalties is often used to justify punitive criminal justice policies, proactive information sharing and awareness raising can result in a more balanced understanding, including, a public advocacy around supporting improved prison standards. And the last point that I wish to outline from that sort of joint position of the UN on incarceration is that prison challenges may be particularly acute in conflict, post-conflict and other crisis settings, resulting not only in serious human rights violations, but also in prison riots, which we have seen in our region. Mass escapes, also something that has been noted over the past few years, and the increased potential for the spread of violent extremist ideologies. Okay, and that's also something that that has been noted in our region as well. By serving as drivers of conflict and weakening public confidence in the rule of law. So there is really an important part that prisons play in order to be able to ensure, effective criminal justice systems and also effective public health response. And last but not least, I will also like to mention that this year at the CND, UNODC and WHO issued an information brief or policy brief around the inclusion of COVID-19 vaccination prevention for people inside prisons as well, so that people in prison are indeed a community that are not left behind in this response to COVID management and control. Thank you.
Thank you very much, Karen. Right on time. Yeah. Next, we go on to Pravit Rojanapruk. It's great seeing him again. We haven't seen each other for, God knows, maybe about 20 years, I think. We used to work together in the nation, and I went on back to Australia, and Pravit stayed on, and he moved on to Calsot, went to Oxford, and then moved on to Calsot English, and he's a senior writer over there. I've been following his Facebook Live broadcasts together with his sidekick called Tapana, and they've been doing some really good work informing the world about what's happening in Thailand. Pravit has also been reporting on the huge surge in cases in Thailand, and it's really very challenging to report on it in the midst of very scant data coming out of the prisons. So I'll pass the floor over to you, Pravit. Thank you.
Thank you, Sunny, and good afternoon to you all. I will limit myself naturally to the COVID-19 infections inside the Thai prison system. And just before I start, for the general viewer who may be here, well, there are just somewhere short of maybe 70 million people in Thailand. So that's the population. And out of that, 309,000, according to the Department of Corrections, being detained. Okay, there are inmates throughout at various prisons throughout the country. So 309,000 plus. And as of yesterday, the number of those infected inside the prison is over 10% at 301,809. I think there were like 700 more cases reported just an hour or two ago. But basically 10% and 28 inmates or prisoners have died since the third outbreak, as some of the two previous as the two previous speakers have mentioned about the third outbreak, which began just before the mid of April. Again, you know, this whole report, if you go into the Facebook page of the Thai Department of Corrections, there will be a quite not daily, but almost a daily update. Actually, I've been, you know, looking at it, you could see the number and the stats. That includes, for example, out of the 31,000 who are now, you know, infected and the 28th death, as many as 7,974 are still being treated. Okay, and that, you know, out of that 10% of the prison population who have been infected, we need to look, and I think the two speakers have also mentioned, at the people who are still fighting the, you know, going through the justice system and have not been sentenced or adjudicated by the Supreme Court or at the level of the Supreme Court yet. And that number is nearly 1/6, or, you know, 59,907 according to the Corrections Department. So these are the number of people who, you know, otherwise many or most should be able to be given bail, the right to bail. But in reality, many Thai inmates end up being detained while fighting the charge or even awaiting the court cases, and that is a big problem. On top of at the inordinate number of charges that or crimes that has to do with drugs, as I think some of the previous speakers have mentioned. So, you know, we look into this one. About nearly 60,000. So that's a 1/5 of the whole population inside the prisons could, you know, otherwise have been, you know, let out and either have some of the sentence suspended or reduced, or some non-custodial measures could have been introduced. And due to the widespread infections, as I have mentioned earlier, 10%, you know, over 10% infected. The Thai justice systems is now considering whether some of the inmates could be released earlier or have their sentence reduced, or you know, release out and then put on some electronic tracking device, like the EM, what we call the EM, the ankle tracking device. However, as of now, we're still waiting the decisions by the courts of law on the matter. Having said that, I think it's quite clear to many Thais, at least, that the Thai prison system is overcrowding and very congested, as well as having a rather low standard of sanitary environment. And I think this makes the COVID-19 infections even more severe inside the prison system. For example, and I'm citing my latest conversation with a former less majestic detainees who spent over 2 years, and last year he was back there again. Ekachai Hong Kangwan told me that actually he told me this morning. I rang it up this morning to confirm some of the figures firsthand, and he said a normal cell for male inmates, for example, is around the size around 50 to 75 square meter, and there are somewhere from 20 to 40 inmates, okay, in one of these a cell where they all will spend the night, every night together. And there's only one shared or common toilet inside the prison, which is half, slightly elevated. I don't have a picture, and half visible from anyone inside that room, not the toilet room, but inside the prison cell where the toilet, the loo is located. And of course, the inmates with the least bargaining power, or the newcomers, ends up sleeping close to the toilets. And you can imagine toilets being, one of the possible channel where coronavirus spreads, being shared by 20 to 40 people. And what would happen? 3 blankets are given to each inmate. One used as a bed sheet, another folded up and used as a pillow, and the third one as a blanket. And Ekachai told me normally you only get the chance to wash it once a week, okay, and not all. He said about 10% of the inmates, as far as is concerned, walk barefoot. They don't even have sandals or flip-flops. And of course, the corrections department want inmates to wear masks, but from what we know, not all have access to sanitary masks. Okay, but one of the I don't know whether we should be happy or concerned. One of the rules passed recently, I think a few weeks ago, is to require that inmates try to wear a mask while sleeping as well, sanitary masks. So, to be very honest, this is for today, I'm happy I don't need to wear a mask because I'm alone in the room. But after a year and a half of having to wear a mask outside, it's really getting into you. And having to sleep with a mask, I can't imagine that. Now, there is this issue about, besides the right to bail, which has a lot to do with whether you have the cash or the wealth to help yourself or not. Although the Thai Justice Ministry has a fund, set up a fund, according to people like Kachai, he said, applying for the fund to bail yourself or to apply for bail is not easy, and sometimes your relatives or relations, family relations, do not want to get involved, or they find it difficult to get involved because they have to travel up country to the prison. So this is a quote. I'd like to get a quote from him, because I asked him, I noticed that the Thai word for the corrections department actually doesn't have a word which is even closely resembling that of corrections. Of course, there's prisons that we call remand prison, but the Thai words for corrections departments is simply, a department of royal punishment. Okay, the word royal, because Thailand's legally a kingdom to me. It's like the Royal Thai Embassy, the Royal Thai Army. So it's called the Royal Punishment Department, basically. So the focus is more on punishment. And I think it has to do with any struggle to argue about either the end of the abolishment of capital punishment, or how we could reduce some of the sentences that are related to drug, as our previous speakers have mentioned. And I think this is one of the topics that I do not think it has even entered the mainstream of the Thai discourse or debate. Okay, so far over the past 10 years, we got to the debate whether we should do away with capital punishment or not, and it hasn't really gotten far. Okay, although technically we have been on a de facto moratorium for a few years now, but this whole talk about whether they should be lighter sentence or mere fine for some drug users, particularly not drug dealers, is still, I think, something that has to be put forward and debate widely in Thai society. And maybe, Sunny, your organizations and the UN's Drugs Authority are, I think, best suited to, make it a public debate. I think we need a debate. I think many Thais agree that the Thai system, a prison system, is overcrowded, and of course there are some violations or crimes that need not ends up, or need not put someone in prison, and this is where the debate could go to. But back to the word from Rachatan, or the Thai word for the Department of Correction, which doesn't contain the word correction, it's more like punishment. So I asked Ekachai Hong Kangwan, okay, who is a fairly well-known former Les Majestés detainee, how, because he spent, I believe, nearly 3 years in prison. I asked him what he think about that notion, because I don't see that notion. You think of Scandinavia, some countries, I'm not sure if it's Finland or Norway, some islands, enable or are set or designated as small islands for some prison colony to roam around, basically. Okay, so what for Thais, this is more about punishment, and more punishment, very little, if nothing about corrections or remand. So he said, and I quote him, okay, I asked him about how he thinks. He said, we are treated like dogs, okay, kept in the cage, so we would not be out to bite others. There's no ethos or idea or thinking about correcting inmates' behaviors, and to enable them to come out as a good person once they're released. End of quotation. So, well, basically, there are, institutes to work that probably one can work through, and someone has mentioned the what is it called, the English Institute of Justice or something, which the king daughter, Princess Ba, we always call her Ong Pa. I forgot her full English name, but doesn't matter. The point is, the king's daughter and the institute, came up with this Bangkok rules some years ago, and I think there are channels where you could, or we could, work to reduce the overcrowding, as well as reform some of the justice system to make sure that punishment is proportionate and no one should needlessly end up in prison for something that in many other countries they might just be spending fine or forced to do some social services. So maybe I'll just end my first part here, and of course I'll be more than delighted to answer whatever questions as far as I am capable of answering. So thank you, Sunny.
Thank you
Over to
very much, Kun Pravit, and thank you for a very passionate talk, and also offering alternatives on the advocacy front. Last but not least, I'd like to introduce you to Jerry Finn, or Gerald Finn, and he's a journalist and also editor with this publication called Cambodianness, or it's also known as Tamai English, an upcoming publication, online publication here in Cambodia. He's written extensively on COVID, extensively on the lockdown, and he's been writing really long features on the incarceration of political prisoners, and also the outbreak of COVID in the country's prisons. So without much ado, I'll hand over the floor to Gerald Flynn. On to you, Jerry. Thank you.
Thank you very much, Sunny. Thank you. I hope you can all hear me. Yeah, so I've been working with Cambodianness, the English language online news site. It's the English version of Tamai for the past year and a half now. And in that time, myself and my colleagues, we've worked on a number of stories about Cambodia's prisons, often through the lens of COVID-19 and the risk that the pandemic poses to inmates. But I would just like to point out at this point that I'm not an expert on prisons. I'm not a policymaker, not a researcher. I am a journalist, and it's in this capacity that I've sort of seen how COVID-19 has affected our access to information surrounding prisons and outbreaks. So while we can never be completely sure due to the lack of testing, the lack of transparency, there's a general consensus that Cambodia emerged from 2020 relatively unscathed in terms of public health emergencies. The economic damage that brought a string of social issues out to the forefront, but by and large, we didn't have a COVID-19 outbreak on the scale that other countries were suffering. But the warning signs were all there that prisons would be high-risk settings, and that an outbreak behind bars was pretty much inevitable. And we had other Southeast Asian nations. They were making some efforts, some more successful than others, to reduce their prison populations, all of which are to varying degrees overcrowded. But throughout this, Cambodia maintained its inflow to the prisons, dismissed concerns from rights groups, and really just refused to consider any of the recommendations that were coming from Human Rights Watch, Amnesty International, the WHO, all of these institutions who were warning that when an outbreak did hit Cambodia's prisons, it was going to be bad, and the conditions in which people were incarcerated was going to be a key factor in the severity of that outbreak. But this was key to remember at a time when the government was pretty adamant that Cambodia had done all of the right things. It was guarding against COVID-19, and that it had largely been spared. There's even talk of a book being written entitled, it was about Prime Minister Hun Sen. It was going to be The Handsome Hero of COVID-19. We haven't seen that book published yet. Not sure if it'll still have the same title. But anyway, so it was, despite the devastating economic blow that the pandemic dealt, it was really difficult for journalists to disprove the government's claim that they had protected the country from the massive loss of life seen elsewhere. We had genuinely expected the healthcare system to be overwhelmed. We were braced for the worst. Some foreign journalists were even talking about getting out of Cambodia as they feared how fast things would fall apart here. But somehow that just didn't happen. But what did happen, though, and this happened very quickly, was the government sought to control the narrative of the pandemic. And there was really no room in that narrative for prisoners. Communication with the Ministry of Health, that very quickly became a one-way affair in which they would hold briefings but not take any questions from the press. Usual sources within the ministry, they suddenly went silent. One of the spokespeople for the Ministry of Health, he blocked my phone number, so I have no way of getting in touch with him. And it should be noted as well that prior to the pandemic, I'd found, and I'm pretty sure a lot of the journalists here would agree, the Ministry of Health was probably one of the more open and communicative government institutions. I'd previously had a pretty good relationship with a number of sources there, but COVID-19 has changed all of that. Now even doctors, hospital staff, they're very reluctant to speak out. There's sort of adding to this climate of fear. Throughout 2020, there was a string of arrests over what the government deemed fake news. So this really contributed to this sort of wall of silence that we got from the government. Then in November 2020, we had 2 separate community outbreaks at the beginning and the end of the month, with the later one linked to the wife of the prison department director. So once again, this sort of set off all of the alarm bells again among rights groups, health policy experts, about the need to protect prisoners. But again, Cambodia seemed to sort of enjoy the same luck that carried it through 2020. But then we got the February 20th community outbreak. And when that hit, there was a lot of hope at the beginning that it, like the other community outbreaks, would be sort of 2 weeks of panic, followed by a kind of swift return to normal. It's now been almost 4 months. Cases have gone from around 500 total to more than 38,000 nationwide. Deaths, having previously had no deaths officially linked to COVID-19, we've now lost 348 people to the virus. And of course, as is always predicted, the pandemic has reached prisons. And we believe at least 7 people have died, 7 prisoners have died of COVID-19. But much like the exact number of the actual cases of COVID-19 in prisons, the government just simply won't tell us. But what we do know is that it was May 9th when Praia Sihanouk Provincial Prison first announced that there were COVID-19 cases behind bars. Then by May 13th, 150 prisoners it was women and their children. They were moved from Praia Sihanouk prison to Kampot prison, it's about 100 kilometers away. When they were tested upon arrival, 13 of them were found to be positive. So apparently they had been tested beforehand, but there seems to be some conflicting accounts of how that actually played out. But then anyway, towards the end of May, Kandal prison reported an outbreak. They refused to give any exact numbers to the press. Around 50, they kept saying, and it was about this sort of time that the prison department started to go dark. We just weren't getting any real information from them. They stopped telling us numbers when the spokesperson said to me that it wasn't his job to tell the media how many COVID-19 patients were in prison. Instead, they then sent us on this wild goose chase saying that we'd need to talk to the provincial authorities to get the number for each prison. And then the provincial authorities told us to speak to the directors of each individual prison, saying that they didn't have the numbers. And then, of course, the directors of these prisons then told us to go back to the prison departments. So, after all these phone calls and messages, we've still gotten no further in establishing how many cases were recorded in the prison system. We still don't know. The government won't tell us. But what is somewhat reassuring is that clearly the work of advocates and reporters is having some sort of effect, because the prison department released a statement just last Friday. I think this is, I can't say whether it was aimed at just sort of allaying people's fears or whether it was just in the hope that it would stop us from asking quite so many questions. but they still didn't give a definitive answer to the majority of the questions that the Cambodian press had been throwing at them. So instead, they've said that between 10 and 20% of inmates have contracted COVID-19 in 7 of Cambodia's 28 prisons. What's worrying about this is the fact that this is the official line, but we've heard credible reports from rights groups with information that at least 11 prisons have already witnessed outbreaks. But obviously it's very difficult for us to verify exactly what's happening, as nobody has any real access to the prisons at the moment, certainly not the press. And it's also worth mentioning that throughout this latest outbreak, the one that began on February 20th, the Ministry of Health had been putting out daily reports with the number of cases, and those numbers were, until very recently, broken down by province. So it was much easier for journalists to be able to track the spread of the virus. But it was around the same time that the outbreaks began popping up in prisons that the Ministry of Health decided, for reasons they've refused to explain, to stop publishing data by province. Now we just get a daily lump sum of COVID-19 cases, and then if we're lucky, each provincial administration will publish their own daily numbers on their Facebook page. So obviously it creates a lot of extra work for anyone who's interested in knowing what Cambodia's COVID-19 situation really looks like. But it further obfuscates the truth about what's happening in prisons. So I think we did eventually go into lockdown earlier this year after sort of avoiding that for all of 2020. And then that did actually see cases drop significantly, but it quickly became apparent that the Cambodian government has not created the social infrastructure that's just not in place to make a long-term lockdown viable. People were protesting about the lack of access to food, and in some people's only options for food were shops run by tycoons with links to the government. So obviously this created a lot of negative press, particularly internationally, and so restrictions were lifted, cases have gone back up again. But just to bring this back to prisons, alarmingly, we saw hundreds of arrests for violating COVID-19 restrictions. The government rushed through a new law on this earlier this year, comes with very tough sentences for minor infractions. So, while COVID-19 is running about unchecked outside of the prisons, more people are being sent into the prisons, and very few people have been released over the course of the pandemic. But this sheer volume of prisoners, it's around 17,000 of the estimated 39,000 people incarcerated in Cambodia sit in pre-trial detention. So obviously, this is something that Gloria and Karen touched on as well. Often there is very little access to legal counsel, no date set for their court case, and it raises questions. So why is pre-trial detention being used for non-violent crimes at a time when the bulging prison population is undermining the government's public health response? The stories that we've heard from prisoners are really quite harrowing. People arrested but never convicted. They're waiting in prison as COVID-19 sweeps the country. They have no contact with their family. There's less support from NGOs than there usually is. And they are basically an all but forgotten population. They're basically at risk of death and very aware of that. And many of them have not even had a day in court to fight for their innocence. And, from what I've seen, prison has very much become a tool for the government. In a sense, it's a solution to other problems that the government can't or isn't willing to fix. And this is, I think, why we've got the overcrowding that we do. As Gloria mentioned, it was 2017 when Cambodia clamped down on drugs as part of its election campaign campaign ahead of the 2018 national elections. And what was seen then as a pattern emerged of arresting and imprisoning drug users at record rates. And a similar thing was happening in the Philippines at the time. But while fewer people were gunned down or executed in Cambodia, there was something like 55,000 people imprisoned on drugs charges between 2017 and 2020. So it's definitely contributed in a very significant way to the prison population. And this is worrying because we know that addiction to drugs is rarely solved by incarceration. It requires a harm reduction approach involving treatment, addressing social stigma, decriminalization, but eager to be seen as tough on law and order, and perhaps even unsure or just unwilling, how to effectively treat addiction. The government solution was just to lock up anyone believed to be involved with drugs at any level. Then we also saw the introduction of the law on juvenile justice, which was drafted in 2016, came into force 2017. This was supposed to reduce the number of children being imprisoned. It actually had the opposite effect, with the number of child prisoners almost tripling between 2017 and 2020. So again, for me, it's very hard to get away from this idea that prison is just a one-size-fits-all solution in Cambodia. There's a similar parallel can be drawn between political prisoners, prisoners of conscience, activists. They are, to the government, a problem, particularly the now outlawed Cambodia National Rescue Party, whose popularity posed a threat to the government's stranglehold on power. So for that problem too, the solution was prison. This has been seen again and again. Rong Chun, the trade unionist, Mother Nature, the environmental activists, a number of journalists critical of the government. The courts and the prisons have been weaponized to silence those critical voices on a massive scale. It becomes really quite blatant when peaceful protesters are arrested, charged, handed 2-year sentences, yet Dong Chai, a wealthy tycoon with government connections and a very violent past, he is allowed to escape justice and basically any level of scrutiny after disturbing footage came out of him beating his wife and throwing her down the stairs. And I think that has actually started quite a lot of conversations in Cambodia about the justice system. And it sort of it's exposed it for what it is, a vastly unequal system that favors the rich and powerful and robs thousands of Cambodians' liberty. Many of them likely have not been put into prison for the crimes that they committed in many other countries. So this is why I feel that as journalists we have a responsibility to report on these issues, to try and counter this attitude towards prisoners that assumes that they're guilty and so they deserve to be locked up, when in reality, Cambodian justice being what it is, many of those living in squalid conditions with less than a square meter of space to call their own, they were screwed over by a broken system, and it will impact them for the rest of their lives. But even just if we can get people to consider the fact that throughout Cambodia, hundreds, if not thousands of people interact with prisoners every day. So an outbreak inside a prison poses just as much a threat to the general public as it does to the prison populations. And, again, the conditions in which prisoners are held in Cambodia all but guarantee that that outbreak will be severe. And then that makes it all the more likely that COVID-19 jumped from prisoners to guards to any of the people who come into contact with prisons. We've seen this through construction crews who are working on prison sites. One of them was believed to be the source of one of the infections or one of the outbreaks in prisons. And it really is sort of, it's a failure to protect prisoners, which in turn is a failure to protect everyone else. But despite this, we keep hearing the same thing from the Ministry of Justice, that decarceration or prisoner release schemes are simply out of the question. The perceived threat to social stability that reducing the prison population poses seems to be fueled by this hardline law and order approach. And from the outside of the government looking in, it really looks as though the government regards these calls for these sort of policies as delegitimizing the justice system, which is one of their key means of retaining power. So sadly, I mean, for me, that's why I think that despite the fact that the pandemic has shown very clearly that prison reform is urgently needed in Cambodia, it just won't happen here anytime soon. Thank you. That's back to you, Sunny.
Thank you very much, Jerry. Yeah, it's kind of sad that the whole criminal justice system is viewed more as punitive rather than, rather than correctional. Yeah, before I open up the floor to questions, I think I'll just summarize the discussion. I think some very interesting points have been brought up, and one is the disproportionate number of women in jails and incarceration centers in Southeast Asia. And I think another issue too, I see it in Cambodia, is that with the disproportionate number of women in jails, you also have children brought into the jail system. Maybe Jerry can talk a bit on that. And then also a point has been brought up that the prisoners who are in for drug misuse have also other comorbidities, HIV/AIDS, hepatitis C, a large prison population with tuberculosis, TB, which makes them vulnerable to severe COVID. And how are the prison authorities dealing with it? And Karen also brought up the in the UN system in what reforms are being pushed for and advocated for. Very important point. The health of prisoners is also related to the SDGs, and I think that should be put outright there. If a country tries to in a country's quest to achieve the SDG goals, that prison health, the health of prisoners too must be considered. If not, it's a no-go. And Pravit put out some very interesting insights and touching insights also on prisoners who are not criminals, but these are prisoners who have been taken in for protesting recently and subject to the whole criminal justice system and being put together with offenders, serious offenders sometimes, and that again needs to be looked upon, and shows that COVID doesn't distinguish whether a person is a political prisoner or a serious offender or a child or a woman. The virus just spreads in very close settings. And Jerry also brought out the whole system of data, getting good data, getting good information in a very closed system where the custodians of these centers of incarceration feel that they are the overlords, and that they won't share the data, they won't reveal anything, that the prisoners are basically the scum of society. But then again, it all boils down to the whole thing where prison health is public health. No one is safe until everyone is safe, which is something that the UNODC is pushing for too in the whole advocacy. So before I open up the floor to questions, I think I've got a question here that came in quite early. And this is directed to all the panelists. What are the alternatives to incarceration, both at the front, what are the front end measures and what are the back end measures as alternatives to incarceration to reduce overcrowding in prisons? Maybe we can start with you first, Gloria.
Definitely decriminalization would be the main thing that we would, one of the main things that we recommend. It's something that quite a few jurisdictions, including in Asia, have pursued before. They just haven't worked in the way that they intended. So like, for example, Vietnam or China, that they have, and Cambodia and Laos to some extent have tried to reduce the penalties or to shift penalties from the criminal system to the administrative system. The problem is when those measures under the administrative system are more punitive or just as punitive as the criminal system, then that's a problem. Because the aim here is to remove punishment as a response. And I guess when we're talking about removing punishment as a response to what, then it's definitely including people who use drugs, people who are dependent on drugs. A number of, I know Jerry and Karen in particular highlighted this. It's not like we've done this for decades. It's not like we've seen any improvement, whether it's public health or whether it's or like safety to community or reducing levels of recidivism by putting people into prison. It's not an effective response, whereas we have seen good results come out of taking a truly, genuinely public health and human rights response to people who use drugs, seeing people who use drugs as humans who deserve just kind of like at least the same level of care that people in the community have. So I think definitely decriminalization is something that is being discussed in more and more spaces, even in countries that pursue really punitive drug policies, such as the Philippines. Certainly in Thailand, this has been discussed before. And even in recently, the Minister of Justice, in response to the outbreak, the increasing number of cases of COVID in prisons, he referred to drug law reforms. So there are reforms to the drug law in Thailand that are being considered at the moment. We haven't seen any published details about what those drug law reforms entail, but we're hopeful that this will at least include some alternatives to imprisonment, because there are many. I also wanted to highlight that, like, especially Jerry and Private talked about people on pretrial detention, that certainly for people who haven't been convicted yet and they've been arrested, particularly if it's for violating like COVID restrictions, that they should not be in prison for that. And this has been an issue that people have tried to address, the courts have tried to address in the Philippines, because there's a very high proportion of people in prison on pretrial. And part of the reason is because they can't afford to pay bail. And the bail is for an offense that is a minor low-level offense, but bail has been set too high. People cannot pay it, so they have to serve their time in prison, especially in a time of a pandemic when prisons are so seriously overcrowded. There just really needs to be more of an effort made, and that doesn't require any major change to laws. It's just lower the terms of your bail. Okay.
Thank you, Gloria. Anything to add, Karen?
Thanks so much. Yeah, lots of things to add. I particularly want to pick up, not to rehash what Gloria mentioned, but just to say that one of the other measures that would help ensure alternatives is to look at the drug policies, but in particular, threshold amounts that are contained within the drug law. So addressing these thresholds and possibly increasing them to a more realistic level. The other thing that Jerry touched on, because he spoke about drug dependence, or he spoke about what we all know as addiction. What I would really love people to start understanding is the difference between a person who uses drugs and a person who is dependent on drugs or addicted to drugs, as you know, as a lot of the terminology that's commonly used is addiction. But a person that has a drug dependence or drug use disorder might need and should access on a voluntary basis drug treatment services. But a person that does not have a dependence or an addiction on any substance, putting them inside a treatment facility or inside a prison is not gonna it's not gonna cure their problem, because that is not a solution. There are various reasons why a person gets involved with substance use. And these stem back to areas that a lot of people don't really want to touch, but it's really social development, social and behavioral development. And so again, putting the issue of addressing the drug problem into a punitive lens kind of shifts away the focus from looking at social development at the community level. And this is where we're saying governments should be spending their energy. Look, if we want to improve people's health and livelihood outcomes, we need to address a whole range of social issues, including, poverty and, just a range of concerns. This is the one thing I want to say. The other thing that UNODC are trying to address in this region is this idea of compulsory drug treatment facilities, which are not seen as prisons because they don't fall under the criminal justice or the Ministry of Justice generally. They fall sometimes in different countries under the Ministries of Health. And these are also considered alternatives. But the problem with them as alternatives is again, you are putting people inside a treatment facility that don't have a drug dependence, and they might not even be accessing drug treatment that we know as evidence-based and scientific inside those facilities. Never mind the fact that there are a whole range of human rights issues inside those facilities. There's cases of forced labor, there's human rights abuses that have been reported by groups like Human Rights Watch over the years. And so when we are saying alternatives to incarceration, we're not meaning that treatment as an alternative should be forced or compulsory. But you can actually offer treatment as an alternative to incarceration. Okay, that sounds contradictory, but it actually is not. If we are offering treatment as a voluntary option for people that have a drug use disorder, this has proven to be effective as a diversion mechanism. There are other range of services that can be offered as an alternative to incarceration. And there's so many that I will not mention them all, but the one that I want to mention is within Thailand. And this is a psychosocial therapy or psychosocial clinic that has been piloted within several criminal courts in Thailand. And the one that was that started it was the Thonburi Criminal Court in 2009. And this basically is looking at case management. So the psychosocial element of it is a person who is a trained sort of case manager or counselor understands what the drivers are that led a person that is accused of the crime to come into contact with the criminal justice system. And they try to assist that person deal with those cases, deal with their issues on a case-by-case basis. And so this has proven to be quite effective in, again, preventing not only, offending or people coming into the criminal justice system or going into a prison, but also it's proven to be effective in preventing recidivism. So a lot of people that have been already arrested and put into prison systems, often the reoffending rate is quite high. And so if we deal with this cases of people at an individual level, addressing the social, the psychological, the economic drivers of why they come into contact with the law, we are really doing more of a service than dealing with this issue as a blanket. Everyone is sort of the same, and all the reasons for a person offending are the same, and therefore their sentence should be doled out in the same way. And again, just to reiterate, that comes down to the understanding that people that are in contact with the law are part of the community, part of the society, and we have to address this from a developmental lens.
Thank you very much, Karen. And I've got one question here from Prasan. Hold on. Yeah, Prasan Sharma, and I think that's directed to Karen, being a health specialist. Is COVID-19 vaccination enough to address the overcrowding situation?
No, so COVID-19 vaccination does not address overcrowding at all. And in fact, I'm going to be even more controversial and say decongestion does not address COVID-19 situation either inside prison. It helps with one part of it, which is the transmission, inside those facilities. If you don't have overcrowded prisons, it reduces the likelihood that transmission spreads quite quickly. But it is not enough in really managing COVID-19 inside places of detention. For example, you need really a full standard operating procedures inside those places of detention and a proper plan for the management of COVID positive patients. For example, it sounds so simple. Let's just let people go back into the community. Let's release prisoners. But there really does need to be a plan in place to follow up those people that have been released, to find out if they have shown signs of or symptoms of COVID-19 within the first few weeks of returning to their community. Because in that way, you can also trace back into the prison environment. This is just one example. Another element to consider is, a lot of countries, the health services inside a prison are not offered by the prison medical services team, or the vast majority of the responsibility of that is not housed in, it's not internal to the prison's environment. So a lot of patients need to be referred out into the community if they have really serious health conditions, including, for example, if they're having chest respiratory problems, complications related to COVID-19. Now, you can imagine the amount of security needed to transport somebody out of a prison environment into a community hospital, the amount of protocol that needs to be followed. And then if you take into consideration the amount of people that we know are positive inside the prison facilities themselves. A lot of a lot of governments have come to us and said, look, we want to create isolation rooms or isolation chambers. And we say, okay, it seems like an intuitive response, but the reality of the situation is you're never going to be able to isolate all of the prisoners that have been suspected positive cases, as you would, for example, if a person is just told to stay in their home, right, if they're outside in the not prison setting. And then there's other human rights issues in relation to creating isolation rooms. What is the purpose of that room? You need to ensure that it's not used as a punitive measure, that it actually is used to control the spread of COVID-19. But even that, there's just simply not enough space in a prison compound to create isolation chambers for every case that has been tested positive for COVID-19. So really, there are a range of measures that need to be in place. including, of course, the distancing and the decongestion, but that's just only one really small component of what can be done to control COVID-19 inside a prison setting.
Thank you very much, Karen. We've got a question here directed both to Jerry and Pravid. It's how can journalists or media be more conscious of framing headlines and writing stories that do not further the carceral narrative and stigmatizes people who use drugs? I know both Pravid and Jerry are also editors in their respective publications, and they do a lot of editing and also writing headlines and all that. I'll direct it first to Pravid and then on to Jerry.
Thanks, Sunny. Well, I think it goes beyond the use of words such as junkies or whatever. I think we are dealing with the whole attitudes about drugs users that I think the press, as well as those who want to see reform in drug-related charges, will really have to tackle. Okay, so it's not, I don't think it's just about the headlines. There are much deeper misgivings or bias against those who use drugs, particularly small-time users. So I think the press should tackle the issues, in a more structural manner, touch on the cultural issues. Actually, I was about to say that, as we talk about the number of those in Thai prisons who are facing drug-related charges, which is at the moment, I check it, at 81% of the whole prison population. There is a need to really tackle the issues by winning the public opinion about either decriminalizations of the use of drugs at a small dose in particular, and onto that, as to what would constitute an appropriate punishments for drugs users in Thailand. And I'm just looking at the law. If you use methamphetamine, you face maximum imprisonment term of 10 years, with the additions of or a fine of 200,000 baht. Okay, and of course, most of the small-time drug users or offenders cannot afford 200,000 baht, which is about 6,000 to or 300 US dollars, by the way. So they end up in prison, and that's the whole thing. And maybe there is something, those who want to push for drugs reform, to set the agenda, set the narrative about how countries like Thailand or even Cambodia or others in the region could move forward, can learn from attempts to end capital punishment. Okay, I believe Cambodia have gone through with that, but maybe it has a lot to do with the fact that the return to electoral democracy in Cambodia was overseen under the auspice of the United Nations. But in countries like Thailand, which is struggling, if you talk with activists who are pushing for the abolition of death penalty, they would tell you that it's much harder to win the support from the general public than that of those bureaucrats in the justice ministries or other related state organizations, who are more or less actually sold and think Thailand should move into that direction. And actually, it has been put into the master plan of Thailand, 5 years human rights master plan over the past many years. So how do we deal with the perceptions that drug abusers, drug users, and drugs dealers ought to be, treated and reported? These are very important issues. I think in Thailand, the press more or less these days focus on the drug dealers than just the users. So if you're a drug user, normally, unless there is something very interesting, quote unquote, about it, you won't even really find it on the newspaper or even on the online news at all. Which is, on the other hand, I was thinking that this is also problematic, because I think most Thais are actually not aware that as many as 81% of the prison populations are, being incarcerated for having violated the, anti-drugs law, and many of them are minor offenders. Okay, so a shift from being an offender to that of, a victim. I think this is a narrative, a discourse that needs to change, and I believe that the press can play a part, but I think some NGOs or even UN-related bodies can really, start by kicking the ball, throwing the ball into the field, and let the debate, begins. Whether these people deserves to be treated more than, being treated as an offender. One last thing, the governments over the past few years now are pushing towards the eventual decriminalizations of the use of cannabis. Okay, some medical related cannabis products are already being produced. I think maybe this is one way we can open the debate. So I'm happy to report that most of the press are quite open-minded, at least when it comes to the use or the decriminalizations of marijuana. So I don't know whether we can tack that along and maybe talk about meth and other drugs as well. Thank you.
Thank you very much, Pravit. On to you, Jerry. How can journals be more conscious of framing headlines?
Well, I think Pravit very astutely summed it up there. It certainly has to go beyond just the terminology that we use, especially given that throughout development, whether it's drug use or domestic violence, the correct or most current terminology seems to be changing fairly rapidly. And I think sometimes there is a risk that sort of the shifts in jargon has, for some people, for some readers, I think it complicates matters, or it loses them somehow. So for me, I would say that the key element really should be focusing on giving them a voice, portraying them how they want to be portrayed. Do they feel that they are the victims of a vicious system? Do they feel they are the victims of predatory dealers? Really, I think giving them the chance to explain their story in their own words is probably the best thing that the press can do. But simultaneously calling out abuses within the criminal justice system and the way the government deals with drug and substance abuse. So here, we do have drug detention centres. I've forgotten exactly how many, but there are a number of them throughout the country, and they, exactly as Karen was saying earlier, even for users who are not dependent on drugs or not addicted, it's often an involuntary stay at these treatment centres, and the treatment centres are effectively sort of like a parallel penal system. And so Amnesty International last year did a pretty comprehensive report on the abuses that they found to be widespread throughout these treatment centres. And so I think that is one way we as journalists can try and help address the stigma attached to drug users by showing, how badly the system treats these people. And another is obviously, we do have a responsibility again to do no harm, but I think giving voices to people that are working fairly tirelessly to try and bring about these alternatives to incarceration. One group I can think of in particular in Cambodia, This Life Cambodia, did an excellent report on diversion earlier this year, and they found some of their findings were actually really interesting because it showed that like a lot of the community were actually not opposed to community-led alternatives to imprisonment, but given that a lot of the press in Cambodia is government-owned or government-aligned, this sort of image of being tough on law and order ends up contributing to the stigma against drug users. So I think, I think here the independent media has done a fairly good job of certainly not playing into those stereotypes, but whether that sort of small cadre of journalists is able to completely overturn public perception, or even to be able to effectively measure public perception, is probably worth questioning. Back to you.
Thank you, Jerry. And Karen has raised a hand, and I think she'll have the last word because we've almost run out of time. On to you, Karen.
Sorry, thanks, Sunny. Just one last thing to add to that point that Pravit and Jerry have so holistically shared. Very often I read newspaper reports about crimes that have been committed. A man kills a wife and family, or somebody crashes into something, and then there was a loss of lives. And for some reason, there's this attachment inside the article to the guy was high on yaba, the guy was under the influence of a specific substance. Now, we have to look at really how we are reporting this information. The crime was committed, the murder, the violence, whatever the criminal activity was. What is there really a need to mention that the person was under the influence of a substance? Is that going to improve the story? Because then it becomes the reason that the man committed the crime. And we know for a fact that that is just simply not the case. It might have been, given him confidence or whatever to enable the mentality that, or the whatever he was under. I mean, the person doesn't have to be a man, it can be a woman as well. But there's just too much of a marriage between the person that is using drugs and criminality. And what we're saying is we really need to look at how we are framing those narratives. Drug use in and of itself is something that does not need to be labeled within the criminal justice, realm. And again, when we're looking at drug dependence, we're looking at it as a health disorder. So a person that has an addiction should be considered a person that has a health condition. Why are we merging, the criminal activity and the substance use? These two are just really not necessarily in the same sort of realm.
Thank you very much, Karen. It's been a really wonderful webinar with such rich discussion. The story doesn't end here. We hope to have another follow-up, and let's see how the situation goes forward here. Thank you to all the panelists. Thank you, Gloria Lai, Karen Peters, Pravit Rojanapuk, and Gerald Flynn. I know you guys are like super busy, and thank you for taking just 1.5 hours to be in this webinar organized by Internews. This whole issue of COVID-19 in prisons has brought out, it's a Pandora's box. It's opened up a whole lot of things that were there, in terms of health disparity, health inequity, the whole gender issue, a disproportionate number of women in jail, and the whole issue of the whole issue of corrections versus punitive measures. Thank you very much, and we hope to meet again. And thank you to all the people who attended this webinar. I know there are lots of you who attended from Nepal and India. Thank you very much, yeah? And hope to see you again soon. Bye-bye.
Thank you, Sunny.
Thank you for having me.
Bye.
Bye, everyone. Stay virus free.
Stay safe, everyone.
Thank you, Bobby.